You do not have to accept that a pill is the only lever your body has for managing blood sugar. That is not an anti-medication message. Medication saves lives, and we will come back to that point specifically before this video ends. This is a different message that certain foods, specific compounds in specific forms, studied in controlled trials and published in peer-reviewed journals, produce measurable reductions in blood sugar through mechanisms that are, in some cases, remarkably close to how pharmaceutical drugs work, not folk medicine, not wellness culture, peer-reviewed pharmacology, most of which the average person with diabetes has never been told about. A quick note before we go any further. This channel produces general health education from published research. I am not your doctor, and nothing here is medical advice. Do not stop or reduce any diabetes medication on your own based on what you hear today. In fact, and this is important enough to say before we even start, if you are on any blood sugar lowering medication and you begin adding the items on today's list in meaningful amounts, please tell your doctor, because some of them lower blood sugar effectively enough that the combination could take your levels lower than intended. That is not a warning against using them. That is a recognition that they work. With that said, here are the 5. Stay with me to number 3. It is one almost nobody thinks of as a blood sugar food. Most people know it as a spice or a cooking ingredient, but it contains a specific amino acid that the research shows does something that most people believe only medication can do. Most seniors have never heard of this mechanism. Most doctors have never mentioned it. Before we start, tell me in the comments, are you managing blood sugar with medication, with diet, or both? I read every response, and this video will mean something different depending on where you are. Now, before we go through the 5, here's the one thing you need to understand about how blood sugar is controlled. Because once you understand the system, the 5 foods make a different kind of sense. Each one targets a different point in the same process, and knowing which point changes how you use them. After a meal, carbohydrates are broken down by digestive enzymes in the stomach and small intestine into glucose. That glucose then moves across the intestinal wall into the bloodstream. The rise in blood glucose signals the pancreas to release insulin, a hormone that functions as a key, unlocking the door on muscle and fat cells so they can absorb glucose and lower the blood level. In type 2 diabetes, the locks have become resistant to the key. The cells stop responding. Normally, the pancreas works harder to produce more insulin, and eventually blood glucose stays elevated even when the insulin supply is normal. Think of the body's blood sugar system as a factory with multiple control points. There is the intake gate where carbohydrates are converted and absorbed into the bloodstream. There is a production line where the pancreas releases insulin to manage the flow. There is a second production line that most people never hear about, the liver, which releases stored glucose into the bloodstream continuously, including overnight. And there is the cell floor where insulin keys open the doors to let glucose in. Most diabetes medications work at one of these control points. Metformin works primarily at the liver, reducing its overnight glucose output. Sulfonylureas work at the pancreas, stimulating more insulin release. GLP-1 receptor agonists slow the intake gate and stimulate insulin simultaneously. The reason this matters is that the 5 foods on today's list work at these same control points, not identically, not always as potently in a single dose, but through recognized, studied, pharmacologically understood mechanisms. They are not magic, they are biochemistry. 5 apple cider vinegar, specifically the acetic acid it contains. Apple cider vinegar has spent years at the intersection of wellness, culture, and skepticism, which has made it easy to dismiss. The actual research on what acetic acid does to blood sugar after a meal is more specific and more interesting than most people realize. Acetic acid, the active compound, works at the intake gate. It inhibits 2 digestive enzymes, amylase, which breaks starch into smaller sugars, and sucrase, which breaks table sugar into glucose and fructose. When these enzymes are partially inhibited, the breakdown of carbohydrates in the meal slows. The glucose enters the bloodstream more gradually, and the spike is blunted. Think of the intake gate as a wide door that lets glucose flood in rapidly after a meal. Acetic acid narrows that door. The same amount of glucose enters, but over a longer window, and a slow, steady glucose curve is fundamentally different for the body's insulin response than a rapid spike. Research by Carol Johnston and colleagues at Arizona State University, a group that has studied this mechanism across multiple controlled trials, found that consuming 1 to 2 tablespoons of apple cider vinegar in water before a carbohydrate-rich meal reduced post-meal blood glucose by 19 to 34% in adults with insulin resistance and type 2 diabetes. The effect was specifically on the post-meal spike, which is the most common and most cardiovascular damaging form of blood sugar elevation in people with type 2 diabetes. A meta-analysis published in the Journal of Evidence-Based Integrative Medicine in 2018 reviewed 8 controlled trials and found a significant reduction in fasting glucose and HbA1c in adults consuming vinegar daily over several weeks. 1 to 2 tablespoons diluted in a full glass of water, taken 5 to 10 minutes before the largest meal of the day. Always diluted. Undiluted vinegar can damage tooth enamel and irritate the esophagus over time. If you have a history of gastroparesis, delayed stomach emptying, which is a diabetic complication, discuss this with your doctor first, as slowing gastric emptying further may not be appropriate. For oats, specifically the beta-glucan fiber they contain, most people think of oatmeal as a healthy breakfast, without understanding exactly what it is doing in the body that makes it different from other carbohydrate sources. The mechanism is specific enough that it has earned a formal health claim from the European Food Safety Authority, a regulatory body not known for approving claims without rigorous evidence. Beta-glucan is a type of soluble fiber found in oats and barley. When consumed, it absorbs water in the digestive tract and forms a thick, viscous gel. That gel coats the intestinal wall and physically slows the absorption of glucose from the meal, not by blocking it, but by making the journey from the intestinal surface to the bloodstream slower and more gradual. Think of it as lining the inside of the intake pipe with a slow permeable membrane. Without beta-glucan, glucose moves through the intestinal wall at its natural rate. With beta-glucan's gel in place, the same glucose has to diffuse through the gel first. The process slows, the curve flattens, the spike diminishes. The evidence here is among the most consistent of any dietary fiber. A meta-analysis published in the American Journal of Clinical Nutrition reviewed 22 randomized controlled trials and found that beta-glucan supplementation produced significant reductions in both fasting blood glucose and post-meal glucose response in adults with type 2 diabetes. The effect was dose-dependent. The thicker and more viscous the gel produced, the greater the glycemic benefit. For practical purposes, steel-cut oats and rolled oats contain more intact beta-glucan and produce a denser gel than instant oats, which means a more meaningful glucose effect. Cook with water, not added sugar, and pair with protein and fat to further modulate the blood sugar response. 3. Fenugreek seeds. If you have never thought of fenugreek as a blood sugar intervention, you are not alone. It is most familiar in Western kitchens as a spice and most familiar in South Asian cooking as a bitter, aromatic component of curry blends and bread. The research on what it does to blood sugar is specific enough and surprising enough that it earns its place at number 3 on this list. Fenugreek contains 2 separate mechanisms working at 2 separate control points. The first is physical, a fiber called galactomannan, which behaves similarly to beta-glucan. It forms a thick gel in the digestive tract, slowing the absorption of carbohydrates from a meal in essentially the same way. Described for oats, the intake gate narrows, the spike blunts. The second mechanism is pharmacological. Fenugreek contains an amino acid called 4-hydroxyisoleucine, a compound not found in significant quantities in any other common food, in cell and animal studies, and in several human trials. 4-hydroxyisoleucine has been found to directly stimulate the beta cells of the pancreas to release insulin in response to glucose. It targets the production line, not just slowing the gate, but calling for more keys to be made. This dual mechanism, slowing glucose entry while simultaneously stimulating insulin response, is the combination that most oral diabetes medications try to achieve through pharmaceutical means. Fenugreek achieves both through two distinct natural compounds in the same seed. A meta-analysis published in the Journal of Diabetes and Metabolic Disorders in 2014 reviewed 10 randomized controlled trials of fenugreek in adults with type 2 diabetes or prediabetes. It found significant reductions in fasting blood glucose, averaging approximately 20 milligrams per deciliter, and meaningful reductions in post-meal blood glucose levels. The effects were consistent across study populations and preparation methods. Whether seeds were consumed whole, soaked overnight, or ground into powder, 1 teaspoon of fenugreek seeds soaked overnight in water and consumed seeds and water together 15 to 20 minutes before breakfast is the preparation method used in the majority of the trials. The bitterness is real. Some people mix the soaked seeds into yogurt or a morning smoothie. If you are on any insulin or insulin-stimulating medication, this is one specifically worth discussing with your physician. First, because of its insulin-releasing mechanism. 2, broccoli sprouts, and the compound they contain called sulforaphane. Most people who eat broccoli for their health are thinking about vitamins or general antioxidant effects. The specific mechanism of sulforaphane on blood glucose is something different, and it targets a control point that almost no food on any standard list touches. Mature broccoli contains sulforaphane, but in modest amounts. Broccoli sprouts, the 3 to 5 day old seedlings that can be grown at home or found in specialty grocery sections, contain anywhere from 10 to 100 times more sulforaphane than the same weight of mature broccoli. And what sulforaphane does in the body is not primarily about slowing absorption or stimulating insulin. It targets the liver. The liver is the body's second major blood sugar control point, and the one that operates continuously, including overnight. It stores glucose as glycogen and releases it into the bloodstream to maintain stable blood sugar levels between meals. In type 2 diabetes, this regulation breaks down. The liver releases glucose too freely, including at times when blood sugar is already elevated. This is why fasting blood sugar in the morning is often high in people with type 2 diabetes. Even after not eating for 8 hours, the liver has been running its glucose release program through the night without adequate suppression. Think of the liver as a night shift manager at a factory, responsible for keeping the assembly line running through the quiet hours. In type 2 diabetes, the night shift manager has lost some of its feedback signals and keeps the line running too fast, sending glucose into the bloodstream when it is not needed. Sulforaphane works at the level of gene expression in liver cells. It activates a pathway that reduces the activity of the key enzymes driving that overnight glucose release. A study published in Science Translational Medicine in 2017 by Axelson and colleagues at the University of Gothenburg tested concentrated sulforaphane extract in adults with type 2 diabetes over 12 weeks. Fasting blood glucose was reduced significantly, with the most pronounced effects in participants whose baseline glucose dysregulation was greatest. An important honesty note: the study used a concentrated broccoli sprout extract standardized to a sulforaphane dose that is higher than what a casual serving of culinary sprouts would typically deliver. The research on what everyday culinary amounts of sprouts provide is promising, but not at the same studied dose. A meaningful daily serving of broccoli sprouts, a small handful, 2 to 3 tablespoons, is a reasonable starting point, with the understanding that the research dose was in a more concentrated form. 1. Bitter melon, Momordicha charantia. This is the one on the list most people have never eaten and are least likely to encounter in a standard Western supermarket. It is a staple in South and Southeast Asian cooking, widely available in Asian grocery stores, and the subject of more pharmacological research on blood glucose than almost any other plant food. because it contains not one but three separate compounds that act directly on the body's glucose management system, two of which behave in ways that closely resemble the action of insulin itself. The three compounds are cherantin, visin, and polypeptide P. Cherantin is a mixture of phytochemicals that has been shown in animal models to stimulate glucose uptake in muscle and liver cells, acting at the cell door in a way that partially mimics insulin. Polypeptide P is a plant-derived compound with a structure and function that so closely resembles pancreatic insulin that it earned the informal name plant insulin in early research. Visin is an additional compound that influences glucose metabolism through separate pathways. Together, these compounds work at the cell floor, not just slowing glucose entry, not just stimulating the pancreas, but acting at the cells themselves to improve glucose uptake. And this is mechanistically closest to what insulin itself does, which is why bitter melon is the food on this list that has been most directly compared in control trials to pharmaceutical diabetes medications. A study published in the Journal of Ethnopharmacology found bitter melon juice comparable in effect to glibenclamide, a first-generation sulfonylurea, in reducing blood glucose in adults with type 2 diabetes. A systematic review and meta-analysis published in the Journal of Ethnopharmacology in 2011 examined 5 randomized control trials and found significant reductions in both fasting and post-meal blood glucose in adults with type 2 diabetes consuming bitter melon preparations. Subsequent research has confirmed these effects across multiple preparation methods: juice, extract, cooked whole fruit, though effect sizes vary with preparation. Bitter melon juice, 100 to 200 milliliters, from the fresh fruit is the form most consistently used in the research. Cooked bitter melon, sliced and stir-fried, is the most palatable form for most Western palates. The bitterness diminishes significantly with brief cooking. It is available at most Asian grocery stores and, increasingly, at international sections of larger supermarkets. Critical safety note, repeated specifically for this item. Bitter melon's blood glucose lowering effect is real and significant, and it can potentiate, amplify the effect of insulin and insulin-stimulating medications. If you are on any medication that lowers blood glucose and you begin consuming bitter melon regularly, you may need your medication dose adjusted. This is not a side effect to fear. It is a sign that the food is doing what the research says it does, but it requires your doctor to know because it changes the math. Now consider someone who represents the kind of situation this information applies to. Consider a woman in her mid-60s, call her Dorothy. She had been managing type 2 diabetes for 6 years with 2 medications. Her morning fasting glucose was running around 145 to 165 most days. She was eating what she thought was a healthy diet, was not eating obvious sweets, and could not understand why the numbers kept coming in high. She had never been told what any of the foods in her diet were doing or not doing to her blood sugar specifically. Her endocrinologist added a third medication. Dorothy asked about diet. The conversation lasted 3 minutes. Dorothy is a composite, the kind of case described in diabetes nutrition counseling literature, but what she represents is real. The gap between what is known about food and blood glucose in the research literature and what the average person with type 2 diabetes has been taught, not because physicians are withholding information. A 12-minute appointment cannot cover what a focused educational program can, but because the information exists, it is well studied. And most people with diabetes have never encountered it in a way they could actually use. The 5 foods we have covered today work at 5 different control points in the blood sugar system. Apple cider vinegar and oat beta-glucan slow the intake gate, the absorption of carbohydrates from meals. Fenugreek does both, while also stimulating insulin production. Broccoli sprouts work at the liver, quieting the overnight glucose release that most medications do not fully address, and bitter melon works at the cells themselves, acting through compounds that partially mimic insulin's mechanism of action. Used together, thoughtfully. They cover the system more comprehensively than any single one could alone. Here's your plan starting this week. Add one item from this list per week, not all 5 at once. Start with apple cider vinegar. It is the most accessible, the safest in terms of drug interaction, risk, and produces measurable results within a single meal. Track your blood glucose before and after meals as you add each food. Write down what you observe and bring those observations to your next doctor's appointment. If you are currently on diabetes medication, any medication that lowers blood glucose, please have an explicit conversation with your physician before adding fenugreek and bitter melon. Specifically, tell them what you are adding and why. The conversation may be brief, but it matters because both of these items lower blood glucose through mechanisms that can interact with medication in ways that affect your dosing needs. And do not stop or reduce any medication without explicit guidance. Not because the foods do not work, because blood glucose management requires the full picture. And your physician needs to hold the whole picture with you. Tell me in the comments, which of these 5 do you already use, and which one surprised you most? Your response helps me understand what to cover next. If this was useful today, share it with one person you know who is managing blood sugar after 60, not to give them medical advice, to give them better questions for their doctor. The next video I want you to watch covers the 7 breakfast habits that diabetes specialists say are silently raising morning blood sugar in seniors. Habits that look healthy on the surface, but trigger a glucose response. Most people do not know they are producing before 9 in the morning. Watch that one next.